Hi, my name's Evie. I'm one of the urology nurses. I work at Royal Melbourne Hospital and the Australian Prostate Centre. One of my main jobs is educating and supporting men like you and their partners with prostate cancer, and I run sexual function clinics looking at helping to manage sexual dysfunction and treatment options that are available. Today I want to have a bit of a chat to you about the male urinary anatomy, talk to you a bit about the sexual dysfunction that can happen related to prostate cancer treatment, go through the treatment options that are available for you, talk a bit about penile rehabilitation, and also talk to you a bit about who's available to support you through the whole process. Sexual dysfunction can have an impact on you, throughout your treatment, and it can have an impact on your quality of life and also your partner's quality of life if you have one. Incontinence can be an issue as well, and also patients can find that they can be quite embarrassed talking to people like myself and their doctors and GPs about their erectile dysfunction or problems with their sexual function, but we are trained to be able to help you with this. So what I want to do today is just run through with you a bit about the anatomy of the male urinary tract, so you've got a bit of an understanding about why certain side effects happen. So this is the model of the male urinary tract. So you've got your bladder that collects urine that drains from the kidneys. Underneath that is the prostate gland, okay? So running from the bladder through the prostate and out the end of the penis is your urethra or the water pipe. So that drains the urine from the bladder through the prostate and out the end of the penis. This is the prostate gland. And you've got two seminal vesicles. So these little cloud-like structures at the back, they contain the fluid and nutrients for sperm. Sperm are matured in the testes and they move up sperm cords and mix with the fluid and nutrients in the seminal vesicles and the prostate gland. And then when you ejaculate, there's little ducts that open up and the ejaculation fluid goes into your urethra or the water pipe and out the end of the penis. The prostate also provides fluid and nutrients for sperm as well. So it's got a reproductive function. These little yellow things on the sides here, they're actually kind of representing the neurovascular bundles, which are the nerves responsible for erections. So they lie very close to the prostate gland. Just to give you an idea about the continence with the urinary tract, you've got a sphincter that just sits underneath the bladder and goes into the prostate a little bit, and that is not under your control, and that controls the urinary continence. And also there's a special band of muscles that sit around just underneath the prostate gland that incorporate your pelvic floor, and that's something that you can squeeze and shut off if you want to kind of control the urinary leakage yourself. Just a bit about the penile anatomy. So your penis sits outside the body. It also goes a bit further into the body as well. But what you can see on the outside, you've got two chambers that run either side of the penis called the corpus cavernosum, and they fill up with blood when you get an erection. So the tissue relaxes and they fill up with blood. And there's a certain amount of pressure that's needed in those chambers to allow the erection to be maintained to be able to have sexual intercourse or arousal. You've got nerves and blood vessels at the top of the penis, and also your water pipe runs underneath.